A common question I get asked is, what is the recovery after facelift surgery? Well, on average, the great majority of my patients are back to normal within 2 weeks. But the truth is, there really is a degree of individual variation. And the individual variation in terms of recovery, we could really look at from 3 perspectives. Firstly, what do we actually mean by recovery? Because different parts of the face recover at different times. Secondly, what are the individual factors that influence recovery? And thirdly, what factors can you do to speed up your recovery? So if we take the first element of these, and what do we actually mean by recovery? Well, if we're talking about bruising and swelling, well, about 80% of the bruising and swelling will go in the first week, and a further 80% will go in the second week. So the majority of patients will have most of the swelling go in the first 2 weeks. However, there will still be some swelling that is present. And there are certain parts of the face that are particularly more prone to bruising than others. And the area of the lower eyelids, a bruise here can really last for even 6 weeks. Although after 2 weeks, this can be covered with makeup. In terms of swelling, well, by 2 weeks, the great majority of the swelling has gone. However, there will still be some swelling, and that will take a matter of weeks for that to all settle. And occasionally, swelling can take longer. It can take a certain period, like a period of months. And usually there's a pre-existing condition that may be causing that, but sometimes there isn't. So what about pain? Well, somewhat surprisingly, with facelift surgery, the great majority of discomfort is in the first 48 hours, and after that period, few patients need to take analgesia. How about numbness? Well, numbness around the ears, numbness around the chin. This is often present immediately after surgery and gets better over a period of weeks. Rarely, it can last a matter of months. How about regular activities like using the internet, watching television? Well, really after a few days you can go back to using the internet and television. Very important immediately after the surgery is icing the eyes and icing the face, as this will reduce the amount of swelling and bruising that's present. The other aspect is, when can you go back to your social activities? Well, in general, the majority of my patients will go back to social activities within a 2-week period. However, if you have a very important event such as a wedding, I'd really recommend a 6-week interval before having one of those special events. So let's also talk about what the individual factors are that influence healing. Well, if you have a pre-existing medical condition such as diabetes, well, these need to be well controlled because these influence the way you heal. And having a good control of your sugar will ultimately mean that you have a better recovery after surgery. If you smoke, an absolute prerequisite for me, if you're having facelift surgery, would be to stop both before the surgery and after the surgery. And this is really in the interest of healing and avoiding any potential risks. In addition to that, there's your constitution, and if you have 2 people who have the identical operation, the 2 people will heal at different times, and that's largely due to your constitution. All of us heal at a slightly different rate. Another element that I think is particularly important is the emotional side, and having a positive mental attitude. And there's no doubt for some patients, having cosmetic surgery can be an emotional rollercoaster, and having a positive mental attitude really does go a long way for a comfortable experience. The other element that affects healing is the fact of your surgeon and the surgery that you've had. And surgeons will use different techniques in order to do similar operations. And the way I do facelifting and neck lifting surgery, I use minimal techniques, use hidden incision techniques and telescopic techniques, all of which are aimed at reducing the amount of bruising and swelling and speeding up your recovery. The final element is what you can do in order to improve your healing. Well, certain elements we've talked about, factors like if you have a pre-existing medical condition, making sure that's well controlled. Other factors such as what medications you take and also what non-prescribed medications, and by that I mean things like herbal medications. many of these can affect the amount of bruising and swelling that you get, and I certainly give all my patients very detailed information on what to do both before and after surgery, and included in this is information on what things to avoid in the immediate before and after period. The other element after surgery is icing, and there's no doubt that putting ice or frozen peas or a frozen gel mask on the face for 10 minutes every hour for the first 3 days reduces the amount of swelling that you have and speeds up your recovery. And so I certainly recommend this to all my patients in the immediate post-operative period. In addition to that, there are other things that can be done, herbal medications that also both reduce the amount of bruising, and there's evidence that they improve healing, and I make those recommendations. So the final thing is, I would always say, listen to your surgeon. Your surgeon will give you very clear instructions over what to do to make your experience both enjoyable and also to make your experience both comfortable and your recovery as speedy as possible.